Welcome to Discover Health, a White Mountain perspective. I am your host, Dr. Tom Barela. On this program, we explore health issues that are prevalent in the White Mountains. Today's topic is the Overguard Ponderosa Lions Club and their service projects titled Children's Dental Health Awareness Program and the Vision Screening Program. Our guests today include Norma Weaver, aka the Tooth Fairy. Actually, in talking to her, she's the senior Tooth Fairy. And Susan Jackson, co-chair for the Children's Dental Health Awareness Program. Welcome to the show, both of you.
Oh, thank you.
The senior Tooth Fairy. Now, I noticed that you're sitting here in yellow vests. Why don't you give us an idea what the yellow vests mean?
The yellow vests are for the Lions Club, and our motto is "We Serve." This just sets us apart as Lions Club volunteers.
Oh, cool. And what programs do your Lions Club represent, especially the ones, of course, that we're going to talk about today?
We have a new program just beginning, and its target is the pregnant moms and moms with newborn children, because we have discovered that tooth awareness begins in the pregnant mother. And we tell them how to care for the newborn baby. We stress the importance of the pregnant mom seeking guidance from her physician on how to care for her teeth, to keep her mouth healthy while she's pregnant. And then when she becomes a new mother, we show her how to care for the baby's gums. I have a model of a gum here, and I have a little towel, just a corner of a washcloth. And we teach the new moms how we wet it, and then how to wash the baby's gums after a bottle or a breastfeeding, because the sugars in both the breast milk and the bottled milk have a tendency to cause tooth decay. So this is to make sure that these sugars are out of the mouth and away from the gums, and also it serves a purpose as introducing something in their mouth, so when the teeth come in, they can be brushed with a little tiny toothbrush. I didn't bring one today. I should have, but that's the way it goes.
Actually, I may have one.
So,
They do have little toothbrushes then for newborns.
Oh, yeah.
Oh yes, this is in the shape of a rattle. The baby can grasp it and suck on it or do,
Oh, there we go.
There she is. This is it. And the baby can hold it, and this is after the introduction of having something in its mouth. So then the baby should see a dentist at the sign of the first tooth or a year, whichever comes first, because it's important to catch the cavities before they really begin, and cavities are formed by the sugars in the mouth. A baby should not go to bed sucking a bottle. A bottle should be for feeding only. Also, many children, or babies I should say, have the pacifier. Well, as we all know, the pacifier falls out, the mom picks it up, she licks it off and puts it in the baby's mouth. Bad, because cavities are transmitted from mouth to mouth. Now that seems like something far out, but studies have shown, and especially the CDC shows, that they can be transmitted from the mother to the baby. So don't wipe the pacifier off in your mouth, because you're really not getting it clean.
Wow. So we recognize, of course, that cavities start very early.
Oh, yes.
And in life, and that no alternative for good tooth care starting early on. And the bottle is a very interesting issue. I mean, pediatricians have addressed pacifiers and bottles for years, trying to convince parents not to prop their bottle when they put kids to bed at nighttime, to keep that sugar supply continually leaking into the child's mouth. And we recognize that, of course, is one of the big causes of cavities in young children and stuff. And as a pediatrician, my moniker was, you know, the last thing a child should see before they go to sleep is their bed,
Yes.
not a bottle.
Yes.
It teaches the kids, number one, that they have to learn how to go to sleep, and number two, from your standpoint, it sounds like it keeps them from getting milk bottle cavities. And I have to admit, I did not know the tight correlation between cavities being transmitted from moms licking the pacifiers. I think that probably is related to spreading the bottles, the bacteria that causes uses the sugar to make cavities. But that really is something the parents should think about. I thought about it initially as you were saying that, the 5-second rule of just dropping it on the floor
Right.
and eating
Yeah.
candies and stuff like that.
No, you
Wow.
put it under water and rinse it off.
That is really wonderful. Now, so one of the aspects of your program is to teach children to take care of their teeth right from the beginning. Now, we'll talk a little bit about the program that you're involved with in just a second here, since we got started on this. What other things does the children depend the teeth on? What other things do children need their teeth on other than sucking for a bottle? That is important.
Well, they need their teeth for chewing, for biting, for smiling, and especially for talking. Have you ever talked really to, say, a 5 or 6 year old without 2 front teeth? They're very difficult to understand because they have nothing to.
I remember the song when I was younger. All I want for Christmas is my 2 front teeth, because they don't have to talk with the air going between their 2 front teeth.
Right.
And of course, the surveys that people have done in Arizona and nationwide have shown that 30 to 50% of young children under the age of 5 have unrecognized caries. Tooth decay. And that, part of that, of course, is from bottle care, but also not taking care of their teeth when they're young. And it actually rises to about 60% when you consider older children up to the teenage years. Very bad problem that really starts by not having good care early in life and starting parents out. Well, most people do not recognize that tooth decay is the most common chronic disease in America.
Oh yes, and it's a serious disease as well, because if the cavities are not addressed and filled or taken care of, then that builds an infection in the gums, and that infection goes throughout the system.
I think parents often fail to see the importance of taking care of baby teeth, the primary teeth, because they're going to fall out anyway. And we emphasize to the children that they want to take care of their teeth because it is making a way for the new teeth to come in and for their growth and their jaw and just overall good health. Brush their teeth twice a day for 2 minutes.
Exactly. We tell them twice a day.
Twice a day for 2 minutes.
We say it about 20 times in each presentation.
Well, I want to make sure that we understand a little bit about your club and the things that you do. And you know, you're talking about the dental awareness program. I think that's probably what you're doing. And how did this dental awareness program get started?
The program was actually started in 2011 by 2 members, and they visited the schools and the preschools and the Head Starts on their own, and then they wrote a grant to Delta Dental of Arizona Foundation,
All right.
who has very generously given us a grant for the last 3 years so that we can expand our program, buy props. We include books on dental care for primary care up to
everything that you do.
junior high, exactly.
Oh, yes.
Essentially, so they have sponsored not only the program but your supplies
Yes.
and
made it
everything that's
possible for us to travel.
to do this.
We go in 4 counties, so
You go in 4 counties.
yeah.
So
So we travel quite a
from
bit.
Overguard, you're all over the place.
Oh,
We are.
absolutely, yes.
We absolutely are.
I know
fact-
you're traveling after we taped the program
Yes.
today too.
Yes.
So what do you do in this program? I mean, part of it is education, but
Well, that's entirely our focus.
Okay.
Of course, I'm the tooth fairy, and I come out dressed as a tooth fairy, and the children are in a semicircle, and Susan warms them up with the baby Leo lion.
And we
Which
talk
is on
about,
your lap.
Well, yeah, but look at these beautiful teeth. And we do a lot of talking about how to brush their teeth with the models that we have and how often to brush their teeth. It's just an educational reinforcement
Yes.
for each child.
We sing, we talk about the importance of brushing teeth, and then we sing a song about brushing our teeth, and then we read a book about the importance of brushing teeth. And we involve the children because one of the
Much as
songs
possible.
involves jumping up, so we have them stand up.
and how do you meet these children? I mean, are they through Head Start programs, or do you advertise? And
We have gotten most of the information off the internet. Our chairman, Donna Harris, has supplied us with information on the Head Starts, on the preschools, on the daycares, on the parochial, the church-sponsored schools.
so essentially, any place that cares for young children, or where young children
Exactly.
gather, libraries,
Exactly.
Head Start, daycare centers, and stuff like that, they would just need to contact the Overguard Ponderosa Lions, and you would
Absolutely.
come running.
We would come running. We would come running.
I even did
Well,
a
you guys
pres-
probably wouldn't come running, but well, we're out of time to talk to you about that today. I did learn something today about teeth, and we thank you very much for coming and presenting this to us. Stay tuned for our second segment of Discover Health, where we will have Karen Matthews, the Overguard Ponderosa Lions Club co-chair, for the vision screening program that was mentioned a few minutes ago. Thank you. Welcome back to the second segment of Discover Health. Susan Jackson is with me again, and joining us is Karen Matthews, the Overguard Ponderosa Lions Club co-chair vision screening program. Welcome to us, and I would say welcome back to you.
Thank you.
And, you know, in the first segment of our program, we talked a little bit about how the dental awareness program had some local funding through an organization. How about the vision screening program? Because that certainly is intensive too.
We got our first grant for $5,000, and then we got another grant for $1,000, and then we had private donations so we could purchase our machine. This machine is about $8,000.
Whoa.
So we always put it on with a hand strap. And yes, we do have insurance. But it's astronomically important for us to screen people's eyes.
So essentially you've had local support, private support for your vision screening program, and this is called
This is called a Welch Allen Spot Vision Screener.
the spot screener, and that is one of the accepted things I'm aware of. And they are expensive, so you better, even while you're talking today, you better keep that strap on. All right. So, why should children's eyes be screened?
All children adapt to what they see. They don't know the difference between not being able to see and seeing correctly. So we start usually at about 6 months if someone comes along and wants their child done. 6 months, and we go all the way up to 100 if we need to.
I'm still a child at 100. You know, that is a very important comment in that children do not know what is normal.
Right.
So they may not be seeing normally, but they don't know it.
Exactly. And I'll give you an example. We went into a daycare. This little young man was still wearing a diaper, so it was before preschool, before he went to school, and he was walking around like this. And we said, okay, come on, it's your turn. And he gets up in the little chair, and he still has his head like this. And we're like, well, you, come on, let's see if we can straighten your head up. And somebody had already had this, and I was behind him, trying to get his head straight. Lo and behold, that child could not see out of one eye. That's why he was walking with his head like this, and he was compensating, and nobody knew.
That's an interesting comment, because my next question would be, wouldn't parents normally know if their children are not seeing correctly?
No, they would not. As a matter of fact, from 6 months to a year, almost 2 years old, our referral rate is 41%. That is a lot.
41%?
No, I'm sorry, 21%.
I was going to say,
It's
so
21.
even that seems
That's
like a
high.
great number. So 21% of children that you screen
Yes.
are referred on
That's 6 months to 2 years old.
6 months to 2 years
That's when they're learning their basic skills.
old. Walking, eating, picking up food.
Right. 21% of those children needed an eye exam. It's
Okay.
kind of scary.
Okay. So, I guess the comment then is that we as parents don't frequently recognize vision problems young enough.
Exactly. Sometimes you can tell, like on a lazy eye, you might see it. But then again, if a parent doesn't know what lazy eye is, they have no idea what to look for.
Okay. Now, I know physicians do screening in their offices for babies and stuff, but obviously it's not as sensitive as this spot screener.
Oh, no.
Okay. So the question then is, why use a spot screener? And
We use a spot screener because it can detect 6 different things that a Snelling eye chart cannot.
now Snellen chart is the little E's and
Right.
and letters on that are typically on the wall.
That was designed in 1860. Why are we in the 21st century? The schools are still using this. And
When we have this technology.
yes, we have this technology, and we're here to serve, and we can go into any school as long as they sign a permission slip, and we can screen these children. It takes about 10 seconds. And if they need to go to see an eye doctor, we print this form out that shows an actual picture of their eyes being screened, and it tells what it is.
So this actually is kind of like a medical report that
Exactly.
you get from the vision screener that tells
That's a
what
lead.
this spot screener.
That's a lead for the eye doctor
the eye
where to start.
So if the child's vision is normal by the spot screener, they do not get one?
No, they get one.
Everybody gets
The
one.
school nurse or the parents do get one, and we say at this time our machine says that you're okay, but we always give them one in case they want to go and see an eye doctor. That's where they can start with.
So do you have an idea how many different types of problems this spot screener picks up?
Yes, it'll pick up nearsightedness, farsightedness, unequal
Now,
refractive.
nearsightedness means?
Nearsightedness means you cannot see far away.
Nearsightedness means you see near sight, but not far sight.
Right.
Far sight, you can see far, but you can't see near. Like
Exactly.
us older people?
Yes, that's
Okay.
why I have bifocals.
Okay.
Blurred vision,
Okay.
it will pick up pupil size deviation if one pupil's reacting correctly and the other's not.
You may have different pupil size normally,
Exactly.
called anisocoria, which is important for athletes to know. somebody hasn't recognized that and they have an athletic injury, and on the sports field or the paramedics see one eye different size than the other, they may think that there's a head injury on the inside. So that is a very important piece of finding that may be
Exactly.
not picked up unless somebody has
Exactly.
actually done this type of a screening.
An eye misalignment.
Oh, big problem.
It will pick up eye misalignment. Now this is the 4 or 5 major things that it will pick up. That's why we say, take this to your eye doctor, and they know where to go with it, where to look for problems. But you do need to go to an eye doctor.
Okay, so before we go on to cost type things, where do you do your screening?
Any place that we have a plug-in, we have actually done it a lot in restrooms, because when we go into schools, we need the darkened windows, but we don't like doing it there, okay? But we have no other recourse. If in a daycare, we have the daycare workers with us, so it's no big deal.
So you go into a dark room, essentially.
Well,
that's the physical.
It
But
doesn't have to be totally dark. Just
Okay.
Darkened.
darkened.
So if I asked you to do it on me here,
No. Too
with the
many
bright lights in the studio,
and your
it
eyes
probably
will not
The
dilate.
pupils.
so you need that pupils
Yes.
to
Yeah,
open up
open
to do
up.
this.
To
Okay.
open up.
Okay, so the other half of this is that's the physical location. What kind of places do you screen?
We screen anybody and everybody who wants. We go to health fairs. We go to fire stations and have events. We go to libraries. We've been to this library and had events. We go to daycares, preschools, schools, not just elementary schools. We go to the middle schools, and we can go to the high schools too. There's a need everywhere for this.
And do the schools invite you to come in to screen their kids?
Yes, they do.
So junior high, Head Start.
Yes, as long
High
as
school.
they have a permission slip. We send a permission slip up to the school, and they print them out and send them home for the parents to sign.
So you could have, for example, an eye screening day at, Heber High School or Sholo High School or Snowflake High School, and all the parents would have to do to get an exam, at least by the spot screener, would be to sign a permission slip for that particular day.
Yes.
Okay? And this is important because the next obvious question is, in absence of the spot screener by your Lions Club, how much would it cost to have this type of an exam done?
The cost is averaged out to about, each child is about $200. That's the average cost if you go to a doctor.
For an eye exam.
For an eye exam.
By an ophthalmologist.
With
or
us,
an optometrist.
we're here to serve. It's free. We go in and we do it for free, because vision is 90% learning. You learn from vision. 90% of your learning is from vision. And any child that falls behind in like the 1st or 2nd grade, it's detrimental for the rest of their elementary years. They usually cannot catch up.
Vision's important.
Vision's very important.
Okay. And so, I mean, another issue is always related to follow-up. I mean, you're going to give these to the children. Do you have any idea how easy it is for those children to get into an eye physician to do your follow-up?
We print off 2. If they do not pass our exam, we actually do them twice to make sure. And we will print off 2. And then we call the school nurse and make sure in about 2 to 3 weeks after we've done them, we call the school nurse and we ask, did this child get in? Has this child gotten in to an eye doctor yet? And if there is a money problem, the local Lions can help. Not all Lions Club, well, maybe it does, but our mission is sight and hearing. The Lions Club is known the Knights for Blindness.
The other question I would ask you is, with what's such a wonderful program, is about how many children do you screen a year?
Right now,
Or a month, or
from last August 1st to today, and we may screen more today, we have served 2,178 people.
and that means 400 were referred on.
That means I have my
At
figures here.
21%, that would be about
That's right.
400,
Well, that's right. That's about
400
right.
children. Wow.
And those could be
27%.
6-month-old 1 year.
I understand.
But they could be the parents and the grandparents.
Right.
Wow.
We screen. If somebody we're having a health fair, and somebody brings up 3 kids. Now this has happened. 3 children, and we screened all three children, and we said, well, you know, like 2 of them need to be referred. Oh, I know, they broke their glasses, and I said, what about insurance? And then she said, well, we have access, but they will only buy 1 pair a year.
And it's wonderful that the Lions Club does this.
We stepped in.
Steps in,
But
yes.
an incredible program because,
Yes.
you know, vision is so important, and young children frequently do not get it because healthcare plans do not frequently cover
Yeah.
this type of screening.
Exactly.
So I thank you very, very much for educating us on your wonderful program. And I thank you for being here, both of you today, for both the dental program and the vision program. And I would thank you for watching Discover Health today. And please remember that healthy habits lead to a healthy life. Thank you.